Welcome to this 4-part series on insulin and diabetes. You may be wondering why insulin and diabetes. The reason being, insulin is the underlying factor in diabetes. And here these 4 parts are divided based on the initial part is on the cause, the diagnostics and the nature of the disease. The second part is to do with the current available treatments and the pros and cons of it. And the third part is to do with the complications and the comorbidities associated with insulin and diabetes. And in the fourth part, we look at what are the possibilities for lifestyle correction with specific reference to clinically supported lifestyle correction for diabetes and insulin management. To begin with, the first question to Dr. Jolly Thomson is, all diabetes is generally seen as one by the public and generally patients too. Only very few understand that there is some variety among this diabetes itself. Can you explain about that?
Basically, diabetes is two types. It is entirely different. Both the cause and the treatment is actually entirely different, ideally. But generally, even the patients and the doctors see it as a single entity and give the same treatment for both. But really, both is entirely different. This one is type 1 and the other is type 2. In type 1, the problem is there is not enough insulin. The pancreas is destroyed. It can be because of an autoimmune disease which is destroying the pancreatic islet cells, which is producing the insulin. And on the contrary, the type 2, there is no deficiency of insulin. Most of the type 2 patients, there will be excess insulin. Maybe 10 times or so much excess insulin is there. And here the problem for the type 2 diabetes, the problem is insulin is not working. So in the type 2, the problem is there is high insulin level is increased and the sugar level also is increasing. The type 1 case, the insulin level is going down and so the sugar level is increasing. So it should be seen separately, and definitely the treatment should also be different. But unfortunately, both is treated in the same way, almost the same way currently.
Actually, in treatment also, the patients are usually found to be not understanding which is their diabetes, whether it is type 1 or type 2 or whether it is any other. So often it is seen that it is heard that patients are treated for diabetes as such, and some of them who may be diabetes type 2 are treated in the form of diabetes type 1 and vice versa. Why is it so?
In olden days, when the insulin is freely available for treatment and the medicines, that oral medications came after that, and we were not knowing what is really the difference between type 1 and 2. So the treatment is established as diabetes as a single entity. But now we know what is the difference between type 1 and type 2 and these diseases, what is the fundamental cause for this, and all we know. And also there is facilities for testing that also. In type 1 diabetes, the insulin level will be low if you check. But if the patient is taking insulin, then we cannot check the insulin because insulin injection is taken, so we don't know whether it is low or it is because of the external insulin which is taken. So now there is another test called a C-peptide. C-peptide is an indication of in the body. The insulin is produced as a pro-hormone, and then one part of it is split off, and that part is called a C-peptide. And when we check into the C-peptide level, we know how much insulin is produced by our own body. But the insulin which is injected into the body will not be having that C-peptide fragment. So those patients who want to know whether it is type 1 or type 2 and what is the situation of the pancreas, they had to check the insulin level and also the C-peptide level. In type 1 diabetes, the C-peptide will be low even if they are taking injection of insulin. In type 2 patients, usually the insulin level will be normal or it will be high also. Especially those who are taking this insulin or the diabetic medication, most of the oral medications which is given for the diabetes also actually work through increasing the insulin amount produced by the pancreas. So it will be putting a strain on the pancreas. That is why the diabetic patients can have a chronic pancreatitis. And the pancreatic cancer can occur because we are stimulating with the tablets, we are stimulating the pancreas to make more and more insulin. So hyperinsulinemia, that is also a very dangerous condition. We know that any hormone which is lower than normal and higher than normal also, it is a problem. Only thing is insulin is a silent killer. If it is a thyroid, we know if the thyroid hormone is going high, the hyperthyroidism is a very dangerous situation. So we reduce the with medication or even with radiation therapy, radioiodine therapy, we will destroy the thyroid gland itself. But in the case of the pancreas and the diabetes, the type 2 diabetes, even the insulin level is high, we are injecting external insulin further or giving in diabetic medicines, oral tablets to increase the production of the diabetic insulin. So hyperinsulinemia is the biggest problem there.
See, when you are talking about this type 1 and type 2, generally what should the general public know about whether there are any differences in symptoms in type 1 and type 2?
See, type 1 diabetes, usually we diagnose in the young children. There is a peaking time between 3 to 4 years and again in the 12 to 14 years. That is the time when usually the type 1 diabetes, the children will be diagnosed with a weight loss and the child is becoming tired and fast weight loss syndrome. Usually before that the child will be obese or maybe in the higher side. And after the child gets allergy, this viral infection or repeated allergic episodes, then the child is started losing weight and then they check the sugar will be high. There is an autoimmune disease which is actually affecting the child's own immune system is attacking the pancreatic islet cells, not the pancreas fully. Pancreas has different digestive functions and digestive hormones, etc. Also the pancreas is producing. These beta cells of the pancreas. And that will be selectively destroyed in the type 1 and it is usually in the young age, in the small age and between 3 to 4 years and again at 10 to 14 years. So then another type of adult onset autoimmune type 1 diabetes also is there, that is comparatively slow progressing. In the children, this type 1 diabetes is very active form of the autoimmune this pancreatitis sort of thing actually. And this within 1 to 2 years the pancreas will be totally destroyed. But initial stage, when we look, the pancreas will not be completely destroyed. There will be enough insulin. And when the child is on this insulin, we can check the C-peptide level to see how much insulin is produced. And there will be C-peptide also will be in the normal range. At that stage, if you interfere and correct the lifestyle of the child, then we may be able to stop the progression of the disease. So usually the typical sign of polyuria, polydipsia, that is weight loss, taking more water, always hungry, always thirsty and passing urine all the time, and that will be the typical of the type 1 diabetes patient. But in the type 2 diabetes, it's actually weight gain will be the first, the child is or the adult. Usually it is called adult onset diabetes. Previously it is usually type 2 diabetes was around 50s, 60s, that was the time it appeared. But now it is entirely different. Now the young age, the 12-year-old also getting type 2 diabetes also. That is because of the obesity. One of the main factor for the diabetes is the obesity itself. And next sign is darkening of especially in the children and even adult, the darkening of the neck, around the neck, that is called acanthosis nigricans. That is not only in the neck, the underarms, private parts, and also if in the adult we can see this forehead and the cheek and all darkness can come. So that is darkening skin's manifestation, and also skin tags. Actually, insulin is a growth hormone. It is actually over hypertrophy of the skin. Actually, that is it is actually encouraging the skin to skin cell to multiply fast. That is the reason for this acanthosis nigricans, or the darkening with the velvety skin and the darkening, and also the skin tags. So that is the first sign. Then only at this later stage, this typical sign of polyuria, polydipsia, increased uncontrolled appetite, uncontrolled thirst, always going passing urine, and tiredness, then all is appear only very late stage, in which the pancreas is not able to make any more than the pancreas. Actually, in the type 2, what is happening is, when the sugar is increasing, pancreas will produce more and more insulin and try to compensate. But at this stage, the pancreas is tired and it will stop. There will be, for a normal level, insulin will be there, it will be more, even higher than that. But that is not able to reduce the sugar level. Why? That is called, it is called insulin resistance. Insulin is there, it is not functioning properly. So that is the reason for the type 2. So that's why I said it will be seen as an entirely different thing. One, there is deficiency of insulin, yeah, and the type 2 there will be excess of insulin.
See, you had mentioned that insulin is a silent case in which we know not much of symptoms are shown when there is an excess. But are there any symptoms of excess insulin that can be identified by by an individual?
Yes, that is one is excess weight gain. If the insulin is excess, if you are taking food in the normal level, so if the insulin, you will make all the whatever to take fat or even the carbohydrates or the sugar, it will be converted into fat and stored into our adipose tissue. So whatever you take, if there is enough insulin, it will be, if you are taking excess, it will be converted into fat. So you will be, weight gain will be there. But if you, enough insulin is not there, so in a way, if you are diabetic, in a way you will not become obese. Actually, these obese people, their problem is their pancreas is overactive. So they can, pancreas is overactive, there is no insulin resistance, so there is no diabetes. That is the reason they are putting on weight actually. In a way, becoming a diabetes is which is a sign the body is showing, I don't want any more carbohydrate, I don't want any more fat. Why this sugar is increasing in the diabetic patients? And the type 1 diabetes, it is because there is no insulin. In type 2 diabetes, there is enough insulin, but the sugar is increasing. Why? And usually we can see that the type 2 diabetes, the fatty liver will be there. And also, if you are looking at ultrasound scan, the pancreas also fatty infiltration will be there. Not only in the liver, in the pancreas also fatty infiltration there. So it is actually, this is happening all over the body, because the cells will say, I don't want any glucose or I don't want any fat. The liver itself is making, actually liver is making the fat, and then it will be taken to the periphery, which is adipose tissue, for storage. But the lipid cells, adipose cells are full with that. So they say, I don't want, they won't take it up. So then it is actually not only the sugar is increasing, the initial stage, the triglyceride, this dyslipidemia, triglyceride will start increasing and the cholesterol and triglyceride will increase. And the next stage only the sugar started increasing. The liver is not able to, because the liver is filled with fat, liver cells are filled with fat. So they are not able to make the triglyceride from the sugar. So then gradually sugar started increasing. So you can diagnose the patient can always check not sugar alone, you should check the insulin level. Insulin level, always check insulin and sugar parallelly. If the normal body, if the sugar level is 70 or 100, there is only need for 4 or 5 units of insulin will be there in the blood if you are not insulin resistant. Even if your blood sugar is normal and your insulin level is 15 or 25 or 50, if it is increasing, that means you are insulin resistance. The insulin resistant dyslipidemia and this triglyceride in the blood is increasing. Next, the insulin will increase, or first insulin will increase, then the triglyceride will increase, and then only sugar will come. So, as a symptom, you can take it as excess weight gain, then this darkening of the skin, and then the blood test is done, all these symptoms will be and it should be also taken as a symptom or a sign. We can take it as a sign. If the triglyceride is increasing, or the sugar is increasing, or the insulin is increasing, that is it.
Actually, when someone is identified with the diabetes, normally, initially, they take some medications, and they feel or generally express their satisfaction that their sugar is under control. So, it seems that things are under control. Now, what does the meaning of this under control mean? Because often what is happening is, after some time, the same person, even though under medication, finds it more and more difficult to keep this blood sugar under control. And towards a certain stage, they are happy if at sometimes they are under control, because they feel that it is not possible to keep sugar under control for long, continuously.
See, sugar, the normal level of sugar is ideally between 70 to 140. That is in the fasting level, or in the other ways also, around keeping it around 100 will be the ideal. That is the low sugar level is the ideal actually for the body. Even for the longevity and everything, it is always better to have a low sugar. Low sugar, that is 70, between 70 and 140. For a diabetic patient who is on insulin or other anti-diabetic medication, the problem is the sugar level will go down and the patient will get a shivering or hypoglycemic attack, and it will be very uncomfortable to feel that hypoglycemic even the coming itself. So naturally the patient will start taking food. If you are taking at 8 o'clock the morning dose of insulin or tablets, you will be getting a giddiness or a tired feeling or shivering by around 12 o'clock, because the sugar level is gone down, because the amount of insulin is there. So the insulin is removed all the sugar from your body and make everything into fat. So the patient gradually start eating more because of this medication. So they will be taking medicine, eating more, taking medicine, eating more, and finally the obesity, the insulin resistance will be increasing, because the weight is increasing, accordingly the insulin resistance will be also increasing. So it is very difficult for a patient to keep under control. So previously, when I was starting my medical education in 1980s and all, the control means around that time HbA1c and all is not there. So when the patient is taking around less than 200 will be considered as a okay, but we didn't have any method to check overall level and all. But now we have an overall checking level of HbA1c that all came in the last, it's commonly available only in the last 1 or 2 decades. So now it is easy. We can check that it's according to the HbA1c level. More than the sugar, the overall control of the diabetes is considered as the HbA1c level. HbA1c should be around at least around 6. Below 6 is the ideal, because we take it as HbA1c above 5.7 is considered as a 5.6 is considered as pre-diabetes, and above 6.4 is considered between 5.6 and 6.4 is pre-diabetic, and above 6.4 is diabetic. So that is depends on the doctor's. It is changes at the time. Actually, previously once it was 6, then it is increased to 6.5, then it is increased to 7. HbA1c 7 is considered as control. Now in many places, even American Association, I think it is increased to 8. Why? Because the physician is not able to do anything, because most of the patients are, it is very difficult to keep in even HbA1c at 8. And many patients who are taking 4 times insulin and too many 3 or 4 diabetes medicine, but the sugar level, HbA1c level will be 10, 11, 12. So things are so common nowadays, because you are not treating the real cause. The real cause is excess carbohydrate. You are giving the medicines and insulin, and the patient is becoming more hungry, more because when the insulin level is increasing, the hunger will also increase, and along with that there will be hypoglycemia. So the patient will be suffering between hypo and hyper, and the whole is a mess. That is why no one is able to control. Most of the patients who are on insulin or too much of diabetic medicines not be able to make a control. even 7 is not able to achieve, 8 is not able to, HbA1c 8 is not able to achieve. So that is the problem. Actually, the treatment, actually the medication is the real problem for the type 2 diabetes.
When you are talking about this insulin resistance, you were just mentioning about this pre-diabetic stage. So in this pre-diabetic stage, from what you are saying means you have to check glucose level, but also check insulin level, because from what I understand, this insulin resistance will be quite high in this pre-diabetes stage, and so the insulin in the blood may be very high. So if that is so, at a pre-diabetes stage, we generally hear about testing glucose. Or, what are the other tests that they should do to know their condition correctly?
See, glucose level gives only that time. What is the level? It is changes every hour or every second, we can say, or at least it may not be manifested in every second, because the body is it depends on the activity and what you eat. And if you are eating less carbohydrate, you had only one omelette in the morning and taken or some with a leafy veg, and you check the PPBS, your PPBS will be low. But if you are taking bread or some rice preparation and checking the blood, there's some fruits, then you are checking the blood sugar, it will be high. So we cannot depend on blood sugar level for the control of, or even for diagnosis of the diabetes. If it is you are looking, generally we say that fasting level blood sugar more than 110, it is pre-diabetic, 110 120 it is diabetes, and such distinction is there. But now HbA1c is a very reliable test, and we can check in the HbA1c. Then if that will be, because it will give an overall of the last 3 months. Why it is last 3 months? Because the lifespan of the red blood cells, which is contain hemoglobin, it is the lifespan is almost 3 months, 3 to 4 months. That is why it is taken as 3 months average. But when you are correcting the lifestyle, you don't you have to check, wait for the 3 months to check the other what is the correction in the HbA1c. With the clinically supported lifestyle correction, we check it every week. Actually, if the patient is in the correct track for the lifestyle correction, HbA1c will reduce, sugar will reduce within hours. You can check whether your this thing is within 2 hours. You can see whether it's only you are maintaining that correction, lifestyle correction, that is important. And HbA1c also very fast, drastically within marked difference will be there within a week itself.
How important is family history in diabetes?
See, family history, genetic has a very important role in the diabetes. It is actually, if the father and the one person is, at least one parent is diabetic, the chance for the child will be definitely high. If the 2 parents are diabetic, definitely the chance will be even higher. So for the type 1 diabetes and also for the type 2 diabetes, it is very important, the family history. But doesn't think that if you are diabetic, then you cannot reverse. Or you will also, if the parent is diabetic, the parents are diabetic, you need not get the diabetes if you are living a correct lifestyle.
This brings us to the end of this first part, in which we have seen the reasons, the diagnostics behind it, and also the possibilities of lifestyle correction and all in a brief way. And in the next part, we will be looking at the modern medical treatments available and the latest developments in medicine and surgery with respect to diabetes and insulin. Thank you.